So yeah, so what we're going to do today is Barney has cerebral palsy, which affects his right hand side, so it just means he has a bit more increased tone on that side. So what we're going to look to do today is to use some of the fascial release wax to just loosen off the calf and into the underside of the foot. Generally prefer this product, so the Songbird Fascial Release, from a grip point of view, from my point of view, and also it doesn't get readily absorbed in too quickly to the skin, so that you don't have to use a lot of it. I generally tend to do a lot of my calf release in this position because it allows me to get onto the foot a little bit more easily. So we're just going to bring you up into here and get a bit of product around there. So essentially what we're looking to do is just work down the tissue, initially lightly through the fascia is how I tend to work, and then just get deeper as we work through and just picking up for those areas of tone, and just trying to just let that soften underneath your hand so that it just changes that input, and hopefully then starts to just change the output of what happens around Barney's foot and calf. So I tend to work in this position just into that calf initially. Sometimes I will do it on the front, but in terms of ease of not having to change patient position too often, it allows me then, when we're ready to come down into the foot, and if we just slide away for me, we can then just come straight down into the foot and pick up those other parts. Ticklish?
No, I'm alright.
So just go nice and relax for me, let everything go. Perfect. And then we can just work him up into those areas. And the fascial release wax is generally a little bit better because it allows me to go lighter, because the deeper I go with Barney, the more he'll feel that and generally work against me. So it just allows me to go a little bit lighter to get the movement. And just bring that foot for me. See if you can bring it up. Nice. There we go. Perfect.